Hey, and welcome to Healing Spaces. Today, we're going to talk about how to advocate for yourself in the medical community. Before we get into that, I want to back up for a second. No one goes into the medical or helping profession because they don't care about humans, they don't care about people, and they don't want people to be well. Sometimes we have to remember this when we're accessing care because it doesn't feel like that. But doctors are trained really well, but in a really narrow field. And their options are somewhat limited. And I say that because if we look at allied healthcare professionals, there are lots of things that people do to access wellness. Some folks do nutrition, some folks do different kinds of movements, acupressure, all sorts of things that we can do for our systems to be well. And science is kind of catching up with that ancient wisdom. But medical professionals have a very narrow window or a very narrow window of what they can offer in terms of care. And so they can't just make everything better. They don't know how to make everything better. And our bodies and systems are still quite complicated to us, right? We are still learning, and medicine is growing and ever expanding. So we want to remember that doctors are there because they care. They're trained in a narrow window, and there's lots of things that they don't know about, just like we all have things we don't know about in our own profession. And they're limited in what they can offer. And the systems are not set up well, right? So we don't have a ton of time to chat with our doctors and always share all the complexities that are going on. Doctors have a narrow window of time of what when they meet with us and of what they can offer. So the systems are not set up super well, and that's not our doctor's fault. So, given that that's the setup and we still need to access care through our doctors, they're a bit of a gatekeeper. What can we do? Here's a couple ideas of what you could do if you're advocating for yourself within the medical community. The first thing is take some time before the appointment, either by yourself or with a buddy, and think about all the things that are going on that you want to share with your healthcare provider. This is something that can take a bit of time and be a bit confusing. You might want to prioritize the most important things at the top of the list because, again, we don't always have a ton of time to be able to go through everything. And so you might need to book a follow-up or two if you aren't able to make it through the full list. So take some time, think about all the things that you want to share, what's been going on, and actually write it down on piece of paper or type it out and print it out and have two copies. Now, the reason for this is a lot of people will take time, think about what's going on and write it down, but they'll write it down on their phones. And so when you're in the meeting with the doctor, you're going to easily just skip over stuff. You might not feel heard, so you're like, "Oh, that's embarrassing. I don't really want to try to communicate that complex idea because I don't think that they're going to get it or try to get it." Or you're feeling pressured for time and you're just kind of like scrolling through and picking out nuggets from a scattered brain because you're under a bit of stress in the moment. When we have two paper copies, we can hold on to one and we can give one to our healthcare provider. Again, you might want to have a buddy in the room with you if that's something that would be helpful. Something always to consider is lining up somebody that can come with you and be a bit of a support and advocating. But either way, definitely having two copies, one for yourself and maybe your buddy, and then one to actually give the doctor. Now, if you give the doctor a piece of paper, it becomes a part of your file. Even if they shred it and e-copy it and upload it to their system, they have to, legally, it becomes a part of your file. So that's really helpful information to have. So you have this piece of paper and maybe it's folded on the doctor's desk and you're feeling a bit nervous and you're getting a bit sweaty and they aren't really listening to you or you don't feel like they are. So take some breaths, slow it down and name it to tame it. Hey, I'm here. I'm really struggling. I know you have a lot going on, but I really need some help. And I'm noticing some symptoms that don't totally add up, and I'm feeling a bit lost within this medical system. I feel like things are getting missed. And I really need you to hear me. You're not calling them out on anything nasty or cruel or mean. You're just calling them out on the reality that you're feeling not heard. And what you have to say is really important. Because although they're the expert in the medical field that they're trained in, you're the expert on your body. And you know when something feels off. You know when something feels funny. You know when something isn't quite right. So that can be scary, which is why it might be helpful to have a buddy with you because Buddy can say, "Hey, I feel like we're missing something here." Now, another thing to think about when we're in the session with our healthcare provider is something my grandma taught me. You get more with sugar than you do with shit. So I say that because, again, remembering that the systems are not set up well. Doctors are probably burnt out, tired, they're doing their best, they're trained in a narrow window, they only know what they know, and they're probably trying to support you the best way they can. So if you feel gaslit, if you feel like you're not being heard, remembering that doctor cares about humans and cares about wellness. And if we come into that conversation with more sugar than shit, so talking about the concerns we have, but in an honest, kind, clear, advocating way, as opposed to like rage blasting them, there's going to be a greater willingness for that human on the other side of us to hear us. So that doesn't mean we minimize, that doesn't mean we dismiss, that doesn't mean we people please. It means we speak up clearly and in a respectful way to the other human sitting across from us. I don't know where you are in your medical journey, but these are some ideas that can be really helpful when we're accessing care to take some time to think about what's going on, write out a physical list of when we're there, have a buddy either to write out the list with us or come to us to the medical meeting. And then lastly, call out if we feel like we're not being heard, listen to saying, I feel like I'm not being heard. I really need you to hear me. I have some serious concerns and I need your help. So, those are my ideas. What do you think? Have you been able to access care through your own advocating ways? These are ways that I encourage my clients to use and have used myself. Is this ideal? No. Does this take a lot of time? Yes. However, your body, your system, yours to take care of and yours to advocate for. So, within our system that is as broken as it is, these are some ideas that might be helpful for you to consider if you haven't tried. If you have other ideas, I'd love to hear what they are. Drop me a message or send me an email. Take care. Bye.